Thanks, Kath, very much. Can I just double check that you can see my slides okay?
Yeah, we can, yeah.
Brilliant. That's a good start. So thank you. And it's great to be here. And thanks for the introduction, Kath. So just to give a bit of context before we start, and I think it's fair to say I'm potentially going to be bringing a slightly different angle in terms of our approach, and particularly because of the organisation that I work in. So the QI team is part of NHS Education for Scotland, and we have a remit for providing quality improvement training to a wide group of stakeholders. So just to give you a bit of a flavour, our target audience includes healthcare, as well as social care and the third sector, including voluntary and charity sectors. The broader public services, including things like fire, police and national parks, as well as education, for those delivering and supporting early years, primary and secondary schooling. So we have a broad range of folk that will come in contact with us in terms of quality improvement, training and resources. So we have a virtual public-facing front door called the QI Zone, and that actually includes a number of different tools, resources and information, as well as details of some of the QI programs that we deliver. And I'm going to use some of these headings to help facilitate what I'm going to work through this afternoon. I think, as Ian mentioned, we have also been in a more formal collaboration with SusQI in a fairly recently. I'm joining in January this year. So we have done a bit of work, and what I'm going to share with you is what we've done so far, as well as some plans for the future. And I'm really appreciating the opportunity to hear from others as well today. In Scotland, we've got what we refer to quite nicely as the quality improvement journey. And this particular journey forms the basis of all of our QI programs that we deliver, and also the resources that are available through the QI Zone. We currently deliver 3 key quality improvement training programs. The Scottish Quality and Safety Fellowship, which is a 10-month program focused on clinical leaders. The Scottish Improvement Leaders Program, which is open to anybody across the Scottish Public Service that has a lead role in improvement, as well as the Coaching and Leading for Improvement program, which is targeting managers and leaders of teams to support them to deliver quality improvement. I am going to come back to these later on in the presentation. So just in terms of sharing progress so far, and again, calling upon our good old quality improvement journey, as part of the creating the conditions to support and promote sustainability and the agenda to start with, we've published 3 new pages on the QI Zone, again, publicly facing. The first one raising the climate emergency and also the relevance to healthcare and Scotland's response to the climate emergency. We've also published a page on how the quality improvement journey can support projects related to sustainability. And finally, and I think just as importantly, sharing a number of projects and case studies, which includes SusQI resources and examples, as well as some projects and initiatives in Scotland. As part of our initial work, we mapped at a fairly high level the SusQI framework and the quality improvement journey. And we're able to confirm too that these approaches are core to the model for improvement as a method to support quality improvement. So we're aligning quite well in the opportunity to incorporate sustainability principles into our existing resources. We also pose the statement of sustainability, things you can do for each stage of the quality improvement journey. And challenging people to think about in terms of creating conditions, what specifically might you be able to do in relation to sustainability? And we also use the opportunity to promote and connect to any existing Scottish agendas and strategies, and in particular, the value-based health and care approach that is part of Scotland's strategy at the moment, as well as the NHS Scotland's climate and emergency sustainability strategy. We also went through, and I'm not going to go through these in detail, but in terms of understanding your system, things you can do, developing your aims in relation to sustainability, testing changes, when you come to implement and spread, and just to finish with measurement, leadership, and communication. And I'll start to now show you some specific things that we've incorporated into the existing resources. So we talk about the project charter. So with the project charter, we've intentionally now added at the top of every project charter template, the dimensions of quality, which now include sustainable. So we're getting our learners to think about from the outset, which are the dimensions of quality their projects align with. Also with the hope that they'll be thinking about sustainability now as part of their work. We've also in the rationale included a prompt explicitly talking about the outcomes for people and populations potentially, but also the impact in terms of the resource use, about the environment, finance, and people. We've also updated our measurement plan template with a specific prompt where relevant to describe how their current measures would contribute to sustainable value. And I think that's accepting that some measures perhaps just need that prompt and a conversation to make the connection, while others might actually include a brand new measure to be very explicitly measuring something like the environmental impact. We've also incorporated and strengthened our teaching around balancing measures, again, to ensure that any improvement is not creating inequity within the system, but also to be monitoring any unintended consequence on resource use, like environment, finance, and social. We're also now considering too the concepts in terms of prevention, patient empowerment, lean pathways, and low carbon alternatives and estates provided by SusQI as how we can use these as idea generation exercises when we identify change ideas that we can test within the system. One of the things that I do know that's going to help people get on board, and that's the power of using real life examples. And that's one thing that we know is going to be really helpful and continues to be helpful in engaging others. We also know that there's probably two groups of people that come into our educational programs. One, that the sustainability is the reason that their project exists, but others that we need to support to make them think a little bit more broadly about some of the sustainable value elements they could be incorporating into their work. So some specific examples that we're able to share through the Scottish work that's already been done focus on things like reducing food waste in hospital, looking at appropriate clinical waste disposal, as well as supporting children in a high school to increase the amount of plastics they recycle on a day-to-day basis. And with our colleagues through the Scottish Graduate Entry Medical Programme, there are a number of QI projects focused on planetary health, looking at reducing carbon footprint to and from a GP practice, and also focusing on appropriate use of metered dose inhalers. So it's through these that we're able to provide specific examples of how QI tools can help people with sustainability related projects, such as the use of proto charts, as well as fishbone diagrams. These are just some examples, and work is ongoing. And again, I'm really pleased to be here to hear from others today. So I just wanted to share with you a couple of other things that we have on our pipeline in terms of work. Early next month, we're meeting with colleagues in SusQI to help us explore a little bit more about how we can use carbon footprinting in existing projects. And so we're going to be looking at a particular project that was focused on sustainability and antimicrobial stewardship, and to be able to report much more explicitly on the potential carbon footprint reduction as a result of those improvements. We're also looking at seeing how we support graduates from our programs. We've got a number of people who have already completed our QI training programs. So how do we support them? So we're thinking in terms of running specific workshops for our alumni, promoting the idea of sustainability and quality improvement together, and potentially looking at animation and how we can describe and link QI to sustainability, and continuing to share examples, because again, I do strongly believe that's the one thing that's going to help other people engage to see how it can be done. And I think just as importantly, how we continue to link locally with the Scottish agenda, particularly around value-based health and care and the government's response to the climate emergency. So that's me, and I just want to thank you again for the opportunity to be here today and for sharing where we're at in Scotland. Thank you.